afternoon, everyone. Welcome, everyone. So nice to see you all here today. I'm Dr. Alison McKenna, and I'm a consultant clinical psychologist and clinical lead in Southeastern Trust Regional Trauma Network. And with me today, I have Orla. Would you like to introduce yourself?
Good afternoon, everybody. My name's Orla Connolly. I'm one of the implementation managers in the Trauma Informed Practice team.
So, thank you everyone just for completing the little login poll. This is just so we can work out how far and wide we're reaching. So we're grateful to you for completing this. So this is the first of 6 lunch and learns. We've 5 more after today where we'll be going through each of the focus areas, the 10 focus areas of the toolkit. All the sessions will be over Zoom with the same login details, just to try and make it as simple as we can. This session is recorded and your mics have been deactivated, but we will take questions at the end. We have a YouTube playlist with all the lunch and learns that have taken place to date. So far there are 14 on there, and at the end of this series there'll be 20. So lunch and learns, due to the fact that they're so short, they're really just a taster of a topic, but we do our best to, to provide resources at the end and to cover a reasonable amount of depth, but we can't go too deeply, unfortunately. But we will have a webinar series starting as well later this month, and those webinars are 1.5 hours long. So hopefully you'll receive our communications about those. If you would like to receive a copy of the slides, a link to the recording and the playlist, and a certificate for an hour CPD and any other resources we may have, please enter your details in the window that's appearing on your screen now. Unfortunately, well, first of all, I'll say please enter your name and your email. We need both to send those things out. And we're only permitted to issue certificates to those who have entered their details by 1:10. So we are really keen to gather all your comments and feedback. We'll have several polls that will appear throughout. They're mostly very short, just tick box, so it shouldn't disrupt your viewing of today's session. But you can also put comments, questions in the chat. One of our team is monitoring those at the moment. And all lunch and learns are co-designed and co-delivered by Health and Social Care and the Victims and Survivors Service, and on this occasion, Safeguarding Board Northern Ireland as well. So I'll just hand over now to Orla, who's going to start us off.
Okay, thank you very much, Alison. And really, I'd just like to start by thanking Alison and her Regional Trauma Network colleagues for the opportunity really to discuss and promote the toolkit within this forum. So it's lovely to see the interest in today's topics with, so many keen to thinking about how they embed a trauma-informed approach in our organisations, teams and services. As I said, I'm one of 4 implementation managers based within the trauma-informed practice team. And you'll see from the next slide here, I joined the team in August 22, and my background over the last 25 years, primarily within social work within the Southern Trust, but I've also worked in child and adolescent mental health services and spent a period in terms of working with suicide prevention and post-vention support. So our team is you'll see from the next slide, Alison, embedded within the safeguarding board for Northern Ireland, and in many ways the Safeguarding Board is made up of member organisations from the statutory, community and voluntary sectors. So the SBNI, really operate through a series of committees and panels, and there are committees on child protection, child exploitation, online safety. And while the focus is on children and young people, our work is really focused on across the lifespan. Our work is overseen by the Trauma Informed Practice Committee. And you'll see from this diagram really that the original focus of the teamwork was really focused on workforce development and training, and the development, many of you will be familiar with the level 1 and 2 in-person and online training modules. We've organised conferences over the years, and we've another conference coming up next week on the 23rd of January, which is fully booked at the moment. It's called Systems to Support Our People. Some of you will also be familiar with the research, perhaps that launched by Queen's University in 2018, where they had really produced a suite of papers on key messages for child welfare, the health system, the education system and the justice system. And this is all available on our website. Some of you will also be familiar with the most recent research from Queen's University, which was launched in February of last year, and we'll be talking a wee bit more about that shortly. We've also had various implementation models and pilots over the years, and a number of organisations participated in external pilots, and we have asked University of Ulster at the moment to prepare a report to really share the learning with all organisations on those organisations who took part in these pilots, and to really look at cascading the knowledge and learning from those. So this toolkit that I'm going to talk to you about today is really a part of the overarching picture. And you'll see from the next slide that the toolkit is divided into 6 sections. And the first section, it's online, it's interactive. You can, kind of flick throughout the various sections. But it's really, in essence, a framework and a guide for layering up your understanding of what it means to be a trauma-informed organisation, a trauma-informed service, or a trauma-informed team. And really what I'm just going to do over the next 15, 20 minutes is really provide a brief overview of each of these sections, really to provide some background and context in terms of what we're going to be covering over this series of the Lunch and Learns. So what you'll see really is just to outline, the toolkit was developed in collaboration with a range of individuals and organisations. And we really want to acknowledge, you'll see there, kind of those who provided lived experience input, our task and finish group, the organisations who shared feedback as part of the user testing, those who contributed examples, and really we want to acknowledge the platform provided by the wide range of local research that really informed this toolkit, as well as that international research as well. Also acknowledgement to the toolkit designers and our local artist, Beth McComish. For those of you who have seen the toolkit, you'll see Beth's illustrations infused throughout this. So in terms of the toolkit aims, really this is what we wanted the toolkit to do, to really provide, an understanding of how we can embed a trauma-informed approach across our organisations. We want to build an awareness of what the trauma-informed principles are and how to apply them, highlight the evidence base, showcase examples. So we make this actionable for individuals, for teams and for organisations. And, Alison will talk later about the self-assessment checklist, which hopefully will support organisations to really think about that implementation plan in terms of taking this work forward. The target audience, just to let you know, it's for anyone. You'll see on this next slide here, it's really about trying to help leaders, workforces, services and organisations to reflect on progress, strengths and opportunities for embedding a trauma-informed approach across policy and practice. Alison, if you just move on to the next slide there. So it's really about complementing existing organisational priorities, driving improvement, innovation and sustainable change. And really, we know that there's this growing appreciation that a trauma-informed approach is key to delivering best practice across public and community-based services. So this toolkit was really in recognition of the increased demand for training, information and guidance on how to build this capacity. Moving on into the second section of the toolkit, it's really talking about those key concepts. And a core aspect of understanding what a trauma-informed approach is actually being able to define trauma. What does it mean in terms of really understanding trauma and its wide impact? So we're looking at the imprint of trauma, not just at an individual level, but at that family level, that organisational level and that community level. And you'll see from some of those blue quotes there in the boxes, they're extracts from the toolkit. So it's really thinking about trauma is something that overwhelms our ability to cope. But it's really important to emphasize that it's just one possible response to adversity. That resilience is possible with timely support. So fully acknowledging the imprint of trauma and adversity means that we really understand our stress response system. Individuals in different roles will need different levels of trauma training. So if a person has experienced, perhaps cumulative traumatic events, we need to understand our stress response system. We need to know that, traumatic memories are formed and stored differently to everyday memories, and that people can experience as images, thoughts, smells, sensations, and sounds without much context. So we have people who can be triggered in the present because of their experiences in the past. So trauma can really affect our ability to feel safe and develop trusting relationships. So when we're thinking about trauma, adversity and resilience, we need really to be thinking about the importance of relationships, the presence and interactions of others, that one nervous system interacts and influences another, but also really thinking about those positive relational experiences and how they are key to regulation and resilience. So this section, Key Concepts, is about infusing our understanding of theories, models and concepts related to trauma and adversity. And you'll see on the next slide, when we talk about adverse childhood experiences, we are not just talking about, childhood experiences. We're talking about adverse community experiences, adverse cultural experiences, adverse organizational experiences. So again, we're really thinking about the many multifactorial aspects to our health and development. So when we think about, the principles of a trauma-informed approach, on this next slide, what you'll see is we want to have programs and organizations and systems that realize how widespread trauma is. And many of you will be aware that there's going to be specific Northern Ireland research launched on the 6th of February with Northern Ireland Prevalence Study on Exposure to Violence and Adversity. We want organisations to recognise the signs and symptoms of trauma in clients. We want to be able to respond and we want to do no harm. So we want to actively seek to how do we resist re-traumatization. So those principles are really thinking about how being trauma informed really emphasizes the importance for our staff, for those who come in contact with our organizations, of supportive relationships, supportive working environments and supportive communities. And you'll have heard me mention there about the international context in relation to this. And coming over to the conference next week is we have speakers from the US, speakers from Scotland, and again, talking about this international approach, but also this whole systems approach to reducing the impact of adversity. And you see there just some of the examples of how within Northern Ireland there are multiple strategies and frameworks working to the same objectives. And you'll see on the right there, you know, we're very welcoming of the fact that we have the inclusion in the draft programme for government of this commitment to work across the executive to embed trauma-informed and responsive systems. And, you know, the statement that we will develop a trauma-informed public sector. So the programme for government is talking about this trauma-informed and joined-up approach. So again, when we are talking about a trauma-informed approach, it's really thinking about this whole system organisational change framework. We want to work towards these coherent cultures, policies and practices across all systems of service deliveries. We need this to happen, you know, across our environments, policy systems and organisations. And you'll see here, you know, this is an extract from Queen's, which is really saying that, you know, a trauma-informed approach recognises that many service users, patients or clients across our services have been impacted by multiple, you know, traumatic experiences across their life's course. And therefore, a more responsive form of service delivery is required. And what they say is the 6 principles should really underpin all service delivery. So when we're talking about organisational culture, we're really thinking about how we do the work is the work. This is not just about trauma-specific and therapeutic services. This is really thinking about how do we invite everyone to put a spotlight on those six principles of a trauma-informed approach. And you'll see from the next slide, these 6 principles that are used in the toolkit and that we put a spotlight on in this 3rd section. They were adapted from Harris and Fallow's original 5 principles. And it's about how do we create cultures of safety. And we are reminded that when we talk about safety, we're not just talking about physical safety, we're talking about psychological safety. Many of you will be familiar with Gabor Mate's quote where he says, safety is not simply the absence of threat, but it is the presence of a connection. And it's so important that when we are supporting individuals who have been impacted by adversity and trauma, that they feel heard, that they feel understood. Because when someone gets it and understands the imprint of what we have been through, this experience can really reduce stress at that biochemical level. So how do we create cultures of safety in our everyday behaviours and interactions? How do we create cultures of trustworthiness? How do we make our processes predictable and understanding? How do we embed the principles of choice? Because these principles of a trauma-informed approach are actually experiences that contradict trauma. Because if we have had experiences where our distress doesn't matter, you know, adults are not people you can trust, and we provide experiences that contradict that in our relational interactions, this is really important that we think about this as guiding principles, the importance of offering choice where possible, the importance of being collaborative, doing things with people, not to them, the importance of empowering people and inclusion. Because, you know, Van der Kolk tells us that the 2 most stressful experiences for us as human beings are isolation and restraint. So we want to promote inclusion. We want to recognize the healing value of connection and relationships, and how do we be really intentional about this within our services, teams and organizations. So We can do this by having a walkthrough of a patient's client or journey. What's their experience of ringing the booking centre, asking for directions? Consider our language, our tone in all types of communications. How do we ensure a warm welcome when you enter our services? How essentially do we reduce any barriers to people accessing our services? So it's all about, relationships matter. We really need to think about the importance of connections with others, supportive and nurturing relationships. And this key message on the next slide, how timely relational support can really help counterbalance its negative effects. So we can create environments and services that reduce stress and the risk of individuals becoming overwhelmed. And again, you'll see there, this approach can prevent further trauma to anyone accessing and providing services. So the next slide is really is a summary infographic, and really thinking about, you'll see at the center of that is relationship matters. And we have to bring people together with shared purpose. So this is what we want to do. Trust comes through forming healthy relationships with people. So the fourth section, just before Alison comes in and does the last two sections, really speaks to the Queen's University research that was finalised launched in February of last year. And we had asked Queen's to really look across Northern Ireland, ask organisations, where are they at in terms of implementing a trauma-informed approach? So we want them to really map progress in Northern Ireland, identify barriers, enables and challenges, and make recommendations. Now, I'm not going to get into this in too much details, but essentially this section of the toolkit was really recognising that when we're talking about implementing a trauma-informed approach within large systems, there's no doubt this is more complex. We recognise that systems are overstretched at the moment, but yet we need to identify our barriers and enablers, because if we do, organisational transformations are more likely to succeed if they identify their barriers and enablers and put mechanisms in place to address them. So essentially, Queen's then, you'll see from the next slide, I'll let you read some of these in your own times. They highlighted some of the barriers. They highlighted some the benefits. They highlighted the enablers. But essentially, while recognising what some of the barriers were, they provided a very comprehensive list of what the benefits are. And that quote you'll see there are no downsides to this at all, was something emerging from that research. And again, on this next slide, I am not going to get into these now in detail, but I will give you the link to where you can read all of these. But these are a summary of some of the benefits that were shared across all those organisations that participated in these research, whether from the senior professionals focus groups or from those individuals who answered questionnaires. And they were talking about the benefits for service users, for families and caregivers, for their staff, and at a service and systems level. Now, in essence, what Queen's concluded with the recommendations and their case studies was they were saying essentially that we need a top-down coordinated approach. And that's why we're really welcoming of the recent draft programme for government comments, because we need a coordinated approach to this. And we'll talk a wee bit more in some of the upcoming sessions about a coordinated training framework, different levels of training for different people according to their role and remit. But just briefly before I finish, you can get any of this information on the website. You can listen to the research findings, and the link is on the next slide. So this final infographic is really saying, there is lots of parts to becoming a trauma-informed organisation and system. Alison is going to talk to some of these now. But we do want to say we recognise that extended implementation periods are required. We don't want people to be overwhelmed by this, and we really want people to look at where are their quick wins, and really to never underestimate the importance of small steps in thinking about where we can all play a part in sowing seeds, creating those positive ripples in terms of how we all play a part in implementing a trauma-informed approach. So hopefully that's given a brief overview of thinking about what we're going to be talking about in the common sections and those first 4 sections of the toolkit. So I'll hand over to Alison now really to talk about this next 2 sections. Thank you.
Thanks, Orla. Let's have a very brief overview then of the organisational checklist focus areas, of which there are 10. And this illustration here by Beth McComish, it contains the different features, the different focus areas with little illustrations of them, which is helpful for remembering them. And each of the following 5 lunch and learns will cover the key points of 2 of the focus areas and a worked example of each. So if we look at learning and development first, so on the 28th of January, Orla and Joanne Manari will be introducing these 2 focus areas. So in learning and development, it's really essential that there is adequate workforce training for the effective delivery of trauma-informed services. Introductory training is recommended for all staff, and see levels 1 and 2 of SBNI's introductory training on adverse childhood experience awareness and developing trauma-sensitive practice. Introductory training, as I said, is recommended for all staff, and next week Orla and Joanne will be presenting the trauma-informed lens, which is a valuable tool for the design and delivery of high-quality trauma-informed training. And then also next session, workforce wellbeing will be explored. There's increasing recognition really that secondary or vicarious trauma among frontline staff is a very real risk. So it's essential to have a supportive organisational culture with a trauma-informed approach in high pressure environments. And they'll also look at a particular tool to support professional self-care. And then on the 11th of February, a fortnight after that, we'll have Karen Morgan from the Victim and Survivor Service and Sheena Rigg from SBNI presenting on these 2 focus areas. So looking at environment first, Karen and her team in the Victims and Survivor Service and the team here at SBNI work together to obtain accredited or quality mark status as a trauma-informed organisation with one small thing. She'll discuss the learning and the things implemented within the Victims and Survivor Service as they applied the toolkit. In relation to policy and practice here, a lack of consistent and clear policies and procedures, or policies and procedures that are too rigid or not compatible with trauma-informed approaches were found to be significant barriers to trauma-informed implementation within the Queen's study. Trauma-informed principles should be included in existing policies, and relevant policies should be in place, such as these listed here, such as service user involvement, confidentiality and record keeping, workplace safety and support. And then moving on to the subsequent session on the 25th of February, Karen Morgan and Orla Connolly will be covering resourcing and leadership. So in relation to resourcing, an insufficient budget would be a central barrier to implementation, and we have to do as much as we can practically within the limitations in that regard. Not only financial though, but also staffing resources are essential too. As trauma-informed approaches is now a key action in the programme for government, perhaps this will give impetus for funding towards it. And Karen will also be discussing how the VSS recruited trauma-informed champions and worked closely with the SBNI and educating the organisation, drawing on the toolkit to meet the criteria for one small thing. The Queen's report also emphasised that leadership buy-in is required if meaningful and sustainable change is to occur. So training at the highest echelons of organisations is essential. Their buy-in ensures that resources are managed in support of trauma-informed approaches. The Queen's report also identified a lack of senior leadership buy-in as a central barrier to implementation. And then on the 11th of March, Aileen McGuinness and Joanne Manari will first look at the evaluation and sustainability focus area. And this area highlights the benefit of continuing to look at what we're doing and see what we can do better. So it's always an ongoing process of evaluation by reviewing our data and modifying our practices as needed. And outcomes-based accountability is one way of achieving this, as it focuses on data to answer the questions: how much did we do? How well did we do it? And was anyone better off? Celebrating successes and partnership working between sectors also features here, which brings us to working together and a culture of collaboration which will allow trauma-informed approaches to take place. So we do our best to work together, all pulling in the same direction, and this includes interagency, intersector cooperation. Indeed, a good example of this is the Regional Trauma Network's partnership model between the trusts and the community and voluntary sector. And then in the final week, on the 25th of March, we have Marion Malloy and Paul Gallagher, and they will start with lived experience and involvement. So in our organisations, we can sometimes become a bit desensitised to things that require improvement, can't we? But users of our services are well placed to identify needed changes and think broadly about how to change. But it shouldn't be tokenistic, and it should involve not only service users, but carers and staff input as well, both bottom-up and top-down staff involvement. And then that brings us to continuous improvement. And change is a journey. Organisations change in their staffing and their management structures and organisational priorities. So trauma-informed approach implementation may need to be reviewed regularly so that it remains despite the changing landscape. So we should also review our trauma-informed approaches and check what the evidence says about its effects. So the organisational checklist then contained in the toolkit can provide a way of measuring baseline against improvement over time. Its core function really is to support organisations to measure progress. So you can see here this little quote here. So it helps a system or organisation determine areas for improvement and areas of strength. So we want to look at our strengths as well as our weaknesses. It allows us to assess capacity and target training activities and strategic planning. So we're putting our resources to where the need is most. And it helps leadership and staff understand the need for trauma-informed approaches, and it provides data to validate that need and assess readiness for trauma-informed approach implementation. So we're just going to put out a really brief poll. There's 2 questions in this. One is just for you to self-rate your knowledge before you came here today and now, and we're really just looking to see, are we hitting the mark for what you need today? So if you'd answer both questions, that would be lovely. So the organisational checklist itself, so you can complete this as perhaps you're a lead of your team or a manager, or you can complete it together as a team or within your service. And what you would do here is choose some areas, some focus areas that you want to start with out of the 10 focus areas. And you might like to prioritise 1 or 2 areas, you know. So pick a little bit of this first and work on that rather than taking the whole thing at once. There is a saying, how do you eat an elephant? One bite at a time. So that's why we suggest just taking a couple to start with. And then you're looking at those focus areas in terms of these and seeing where you might be placed on that, and then where those what you might need to do to raise that a little bit. So and just as we move towards the end today, we'll put up in a moment or two, we'll put up 5 more questions, and this is just for the very end. How did the session meet your needs? What was most and least useful? What would you like in future? Okay, so the SBNI have provided us with a fantastic resource in the organisational toolkit, but also with a range of resources here. And we can send these out to you if you've left us your email. So we'll send you out links to these. If you go to the SBNI website, you'll find a wealth of information there to help you. And we'll, I wonder, could we put a little link to the toolkit and the SBNI levels 1 and 2 introductory training perhaps in the chat if possible. So the first 2 here are the Queen's Report, the long and short versions, and then we have some deep dives into implementation. And these were some case studies that were conducted. So this one here is about the Belfast Inclusion Health Service. And this is Fane Street Primary School. And then there's one on the Salvation Army, and this final one here is on the Youth Justice Agency. So you can really take a close look, see what they found and what they implemented and how they went about it. And the toolkit itself is, I should say before I move on, is a live document, and we'll have a link further on here if you want to share. This is it here, sbni.info, to share your feedback or any examples for inclusion, or to complete the evaluation that there is at the end of the toolkit. So, and as I mentioned to you before, this is what's covered each session going forward for the next 5 sessions. And finally, this graphic illustrates a really positive vision for Northern Ireland and a traumatic informed approach, what it can help to bring about and to sustain all these outcomes. And aren't these a supervision? That there's a sense of support of various kinds, that there's psychological safety, that there's connection between us, that there's health promotion, and there's early intervention and prevention. So it's just a really, wouldn't that be wonderful if we could realise all these things as we go forward?